So if I'm a patient and I am looking into having a facelift, what are the questions a patient should ask to make sure that they're not getting one of those light lifts, that they're actually getting a deeper pull so that it'll last longer than a year or two?
So how exactly are we moving this tissue? You're saying that you're going to move my cheeks. How are you doing that? You know, if they're doing it by lifting the skin or lifting the skin and just putting some stitches in the muscle, that's not going to happen. It needs to be using the deeper. There should be minimal elevation of the skin, maximal support of the deep layer. The other thing I would look out for, and this kind of goes against the trend of everything you'll Google and find out there, is there's nothing wrong with doing fat grafting as a complement to facelifting. And we'll use it sometimes for a little fine tuning.
Right.
But if fat grafting is the main course and not a condiment, that's a pretty strong sign that their facelifting technique is too weak. I could show you pictures on my website of very thin-faced, sort of gaunt or atrophied faces that we've been able to provide pretty powerful rejuvenation that's lasted 15 years and beyond, and I have the pictures of those patients to show it. And without fat grafting. That's not to say fat grafting is bad, and
right.
It's not to say it's not a nice condiment, but if it's the main course, that tells me that there's a weakness in the actual lifting part of the procedure, that it's not sort of carrying its weight.
Well, I think that is critical information for a patient to know before going in for a consultation with any physician, is to know the differences between those facelifts and exactly what it is they're looking for.
My consult days are filled, I would say, out of a full day of consults, I will see at least 2 or 3 people who spent less than a facelift, but still a significant amount of money having facial fat grafting, thinking that they were putting off a facelift, and now they find themselves right back at square one. And they're frustrated, a little bit angry, less wealthy, and that's not a fun place to be. So it's definitely one where you want to study the facts, and the tried and true is tried and true for a reason sometimes.
Right.